Ever wonder what a telehealth provider does on our day off? Probably not, but I'm going to show you anyway. You say hi? Hi. If we haven't met before, my name is Keribeth. I'm a physician assistant in Tennessee and a mama. Join my family today as we go to the Science Museum. Later on, when we get back home, I'm planning to fold a ridiculous amount of laundry while we chat about hand, foot, and mouth. You say hi? Can you wave? Can you wave? The planets?
Yeah.
What's your favorite planet?
Making me inside, but we beat it up, Mars, Jupiter, Saturn, and sun.
All right, Susie, get down. Come on.
Good job.
Careful. Where are we going? Okay, start at the beginning. Which planet is this? Mercury.
Venus.
Which one is next?
Venus.
Venus. Come on, come down here. Earth.
Mars.
Mars.
Jupiter.
Jupiter. Saturn. Uranus. Neptune. Very good.
Okay, just see the.
All right, let's talk hand, foot, and mouth while I fold clothes. Let's talk hand, foot, and mouth while I fold clothes. All right, what is hand, foot, and mouth? It is a viral exanthem, aka a viral rash, that happens very often. At least once a year, we see a pretty big outbreak, and that time of the year is right now. So middle of the summer into early fall. It is categorized as a viral exanthem, meaning it's a rash caused by a virus. There's a lot of them: chickenpox, hand, foot, and mouth, erythema infectiosum, aka fifth disease, roseola, measles, etc., etc. There's a lot of viral rashes. This one is super common and tends to be a very unfun one for most parents, and as I'm sure the ones who've had this with their kids understand why. It hurts. It's a painful rash, and oftentimes what it does is it starts. You'll see the lesions initially in the mouth, hands, and feet. There's only a couple of rashes that will cause a rash on the hands and the feet, and hand, foot, mouth is one of them. And they are like blisters, painful, sometimes itchy, but they just are very uncomfortable. And a lot of the time they'll cause sore throat symptoms because those lesions will be even in the mouth, in the posterior throat. Very painful to swallow, painful to eat, painful to drink. It just sucks. It is treatable based on symptoms. So there's nothing that we can do that is going to make the hand, foot, and mouth go away, unfortunately. Tylenol, Motrin are huge. They really do help. They help not only with the pain and fever, but they help with the inflammation and that malaise / achiness that kids can have. Can also help with their sore throat. Topical steroids are sometimes used. Topical lidocaine is sometimes used, really for itching / inflammation / discomfort. But in my opinion, try not to do those. I try not to do those unless the child is super uncomfortable, which obviously you don't want them to be uncomfortable. So if Motrin and Tylenol aren't working, then those are some other options. It usually lasts about a week. I can say, as much as I've seen it, I have seen it last longer than that. But generally, healthy kiddos and even sometimes healthy adults that get it tend to do pretty well and resolve within a week. Is most of the time associated with fever, body aches, chills. Some kids will have them without. Most of them will have the spots with other symptoms like that. I have seen it both. I've seen kids with hand, foot, and mouth that just had a runny nose and a cough. I've seen kids with hand, foot, and mouth that had a low-grade fever and that was it. But it was quite clear that it was hand, foot, and mouth. There are ways that we can test for it, but generally it's literally not going to change the course of anything. So we don't routinely swab for it unless we're trying to rule out something else. So if you go in and you want to test for it, it's there. It's not really recommended. Not something that we generally do, mainly because it's money out of your pocket that you really don't even need to spend. So we go based off of symptoms and appearance and what the rash looks like and the course of the rash, and kind of go from there. What the? It's no longer contagious when those spots have like crusted over and the child has been fever-free without medicine for 24 hours, and notice a general improvement in how they're feeling. So the reason it's such an issue is because it's so contagious. Okay, so let's finish talking about hand, foot, and mouth. So we talked a little bit about what it is and the symptoms that you can get. Like I mentioned before, it is very contagious. And the way that it is spread is several different routes. It can be fecal oral, meaning you go to the bathroom and you don't wash your hands. So always wash your hands. And then it can also be transmitted by the respiratory droplets of the actual virus. So there's a couple of viruses that are known to cause hand, foot, and mouth. Enterovirus and Coxsackie virus are the most common, and they can be passed on by respiratory droplets, as well as the blistered lesions or the blistered rash of the hand, foot, and mouth rash that you have. So it's super important to make sure they're completely crusted over and the child has been fever-free without medicine that would reduce the fever for 24 hours and a general improvement in the symptoms. You want to make sure, of course, as always, washing your hands after you go to the bathroom, after you're changing kids' diapers. That's how it's spread a lot through daycares, is the daycare providers not washing their hands well enough after diaper changes. So that is a super important thing to remember. And then as well as, covering your mouth when you're sneezing and coughing and, just being a good human that's clean. So those are some ways that you can reduce the spreading of it and hopefully prevent little ones from getting it. It can be spread even up to 10 weeks after the active virus when it is in the stool. So that's like why it's so important to wash your hands after changing diapers, because that virus is still contagious for up to 10 weeks in a kiddo's diaper. So make sure you wash your hands very, 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 very well. And hopefully we can prevent future outbreaks like that. As far as treatment goes, I think I mentioned this earlier as well, but it is a treatment of symptoms, and that is about it. It's a virus, so it unfortunately has to run its course. But it will get better. Most of the time it lasts for about a week, sometimes a little bit longer. But it really, keeping your kiddo hydrated, Tylenol, Motrin, all of those things can help with the aches and pains. Obviously, I am not your provider, so this is important to always chat with your pediatrician or your primary care provider before starting any kind of medicines and all of that. Thanks so much for spending a few minutes with me today. Hand, foot, and mouth can be stressful, especially when you're not sure what to expect. But with a little preparation and some extra kiddo snuggles, most kids will recover just fine at home. If you ever feel unsure, trust your gut. We're just a message or a video visit away. You're doing a great job, and we're here when you need us. Don't forget, like, subscribe, and drop your questions in the comments. We absolutely love to hear from you.